All right, so final question. This is it. This is game time. Dr. Mattern, Dr. Butterfield, are you going to get the vaccine?
Well,
I'm going to get the vaccine.
yeah,
I mean, I feel, first of all, I feel like it's a privilege to be offered the vaccine, especially in one of the early tiers. And I have patients coming into my office all day asking me how they can get on the list. And um, you know, I think we've been extraordinarily fortunate in Jefferson County, and a lot of that has to do with our community's been awesome. I think our healthcare system has been prepared, but there's, this is a fragile situation, and at any time, we could be just as affected with COVID as a lot of the other parts of Washington and the country. And so, I feel like as soon as my number's called and I have the ability to get the vaccine, I'm excited to take it. I'm doing it for myself. I'm doing it for my family, who some of them won't have that same opportunity. And so, their chance of getting protected is by me being protected. And I'm doing it for Jefferson Healthcare to make sure that that we can be healthy and safe here to take care of, ultimately our community. So yeah, I'm getting it.
yeah, here, here. I'm second what Steve says. Yeah, this is it's definitely totally appropriate and important to lean into that. The unknown. What don't we know? And we can be a little bit. You can feel a little bit of fear around that, but it's important to not be gripped or controlled by fear. I mean, really, we've had a year in the pandemic of basically being controlled by fear, right? Fear of getting infection. So I'm excited to get to a point where we can move away from that. So you lean in a little bit to kind of the unknown, because what we do know is we've had vaccines for decades now, and we understand what we can do to get out of a pandemic. And here's the thing too. We need people to go first, and I think at times of great crisis in our country and our communities, there are people who are willing to assume risk, right? I think we've all taken care of people who enlisted in the military. I've had quite a few World War II veterans, and I think about them actually in a situation. And when there was a time of national crisis, someone had to step up and they had to enlist. And I think they took on a lot more risk deciding to get on a carrier in the South Pacific, or go and fight in Europe, than I did getting a piece of technology that I'm actually pretty familiar with to fight a disease that I understand a lot more about. So at the end of the day, I think it's the right thing to do personally, but probably more important, it's the right thing to do for our community and society at large.
Dr.
And
Harris?
Dr. Harris?
I knew you were going to ask me. Okay, so Mr. and Mr. Pollyanna here have shared their perspectives on this vaccine. I think my answer for that question is a different answer today than it was, a week ago today. And um, uh, I think I have been. I'm more. I mean, and again, I'm speaking to these phases of grief that I've gone through. I certainly was skeptical as I was first learning about it, especially in the context of politics and the direction that our country had been going in, just in terms of being so conflicted, right? That didn't sit well with me for a while. And then, there was a part of me that was thinking, man, what else do healthcare professionals need to do? Do I need to give my body to my profession too, and be one of those people to sort of be in the first wave of all of this stuff? And then I learned, right? I learned and learned what this vaccine was. With that knowledge for me came understanding. And with that knowledge to me came I think a much more right-sized appreciation of what the true unknown was. And when I compared scientifically and epidemiologically the unknown and the risk of the unknown compared to lots of known, that decision became much more crystal clear to me. And then all of the rest of the stuff. So the thing that drives a lot of us to be healthcare professionals in the first place is a drive to serve, right? To serve our communities in some way. And just to echo you guys a little bit, what an inspiring way to serve in this generation, both our colleagues, our patients, our families, and our communities. So yeah, I'm in.
3 for 3. There we go.